Welcome to the Jamila Adams Experience Podcast. It's a place and a space for women over 40 to be inspired, encouraged, and heard. Your host, Jamila Adams, will talk about how life be lifing and how to find joy when overcoming challenges. You're invited to join the experience.
Hey everyone, thank you for joining this week's episode. I'm so happy that you're here. Don't forget to vote, like, and subscribe to the podcast. And when you do see it, don't forget to share it too. I always have to tell people that. Don't forget to like and to share. It makes things a lot easier for me. And I do appreciate it. So this week, we're talking about the Better Me, Better You theme for the year. And not only with your physical and mental and spiritual as well, we're going to be talking about financial health. So as we go throughout the year, I definitely would like for you to leave a comment or if you have any questions about the guests in the show, because we're trying to build a community here and I definitely want your involvement. So with that being said, today's guest, we're going to Adriana Montgomery from Health Unicorn. And I definitely would like for you to listen up to get some good information from her because she's going to be talking about the policies she has and also the business and how she does it. So with that being said, Adriana, go right ahead.
Thanks, Jamila. It's a pleasure to be here today. Definitely. I'm happy to be a part of, what you're doing here and just the overall knowing that this is geared towards women, and educating them and making them better and even stronger.
Right. So when you started, how long have you been in the organization?
I've been in insurance myself for 7, going on 8 years. And I started because of my husband, who's been in there for 10 years, so it's really a family business that we take pride in.
Oh, good. So as as I'm pretty sure you've come across lots of people in what you do. So what is it that you find challenging? And when you talk with people about the services you provide, I'm sure you have to break it down to them. So how do you explain to them what you do?
Yeah, really it's about good communication and, patience. Sometimes you need to maybe explain it another way or understand someone more, ask them some more questions to understand their perception, and what they may not even realize is going to be the most important for them. So just helping them out with that. That's really what I focus on. If I'm having a hard time helping someone out, or I feel like they're having a hard time understanding, I just dig deeper, talk for a longer amount of time and ask more questions. Make sure to say that, let them know that that's my goal, that they're comfortable and well taken care of, that it's useful, that it gives back to them.
Right. Because one thing about being in the service industry, you have to break things down for people to understand, and you have to ask lots of questions in order for them to at least say the right things that need to be taken care of. Because, when people talk about insurance and anything like that, about policies, it can be overwhelming. So how do you keep it from being overwhelming?
That's a great question. Honestly, part of the strategy, if a client feels like they really just want to see it, they want to understand it more, we'll break it down to them live over a Skype or whatever. Maybe not Skype, right? But a Zoom that we're using nowadays. So that they can see it for themselves, so that they can compare side by side. We do free consultations for comparisons, and that's something that a lot of people find useful, is just seeing one plan directly next to the other and scrolling down and having a broker present at that moment to be able to fill in any gaps and holes in understanding what each plan offers, because there's a lot of interesting plans out there nowadays. And sometimes when you see it itemized in front of you, you think that covers so much. But interestingly enough, with insurance, the simpler that it is, the more it's going to give you a co-insurance, the better off you're going to be. So these are the kinds of things that I can explain and help people understand that I'm on their side, when I'm telling them these things, so that they can now have that information that's priceless and move forward with it. These are the things that you don't get to understand until you become a broker.
Right.
Why it's important to speak with a broker.
Exactly. So in that instance, I see that you enjoyed that part of it. then breaking it down to explaining things. And what do you find is the challenging part to it, to what you do?
Challenging. I don't know. It's going really well. Maybe when we first opened, I would say it was a bit more challenging establishing, I guess, a relationship because we were a brand new company. Right now we're 4 years in, and we can tell you, on our website how many clients, this and that, which wasn't the case in the beginning. So yeah, establishing the trust, establishing just us in the beginning for people to take us seriously, to be able to become licensed in the 42 states where we're at. That was a process, and that grew our opportunity tremendously. And then also the companies, all the different companies that we can offer. That's an advantage for clients themselves.
Gotcha.
So they have access to all that.
Well, that's good. That's good to know. And for me, just listening to you talk about it, you seem so enthused and you just enjoy it. So I'm taking it, everything is pretty much, and once you got past the challenging part, it seems to be enjoyable for you. So with that being said, how do you have a work-life balance between working with your clients, obviously working with your husband, and what you do by yourself? How does that all play out?
Yeah, that's another great question. That, took some time to figure out. That was new to us. We went from working 9 to 5 in an office, but certainly not together all day for what's certainly usually more than 8 hours, when you own your own business. So yes, we really, honestly, to schedule time for everything, cut time out for the things that are your priorities. And there's lots of priorities when you're a family. But we really do cut the time out for date night and cut the time out to put devices away and connect when that's what's, feeling like, we haven't done that in a while. Or, hey, we need to buckle down and focus on whatever needs to be done at work. We'll just schedule that in, really is the best way to do it, because we also have 3 kids. So we have lots of drop-offs and pickups and meal times and bath time. And whatever is going on with the kids, they keep you on your toes. So
Right.
yeah.
And that's one thing about being a business owner. You have to make time for everything. I mean, as I understand it completely. You got to make time for yourself. You got to make time for family. So everything all ties in together. So the more you put out, you have to replenish yourself in the process, because, the more you talk with your clients, the more you try to explain things to them, it can be, I won't say draining, because we love what we do, but after a while, I always say I can only people for so long. So I'm pretty sure you go through that as well, right?
Yes. I always say you are the cup you pour from, because that's what's happening. You only have a finite amount of energy in each day that you can put out. So yes, priorities for sure. I can't, the to-do list, and it's more so like, what am I going to do today? What's the next step to take, here and now? And that's the best way to do it too.
Right.
Really. So you can be present in the moment, enjoy whatever the experience is that's going on.
Great. Awesome. So let's get back to the business aspect of it. So I know that we had talked earlier and you had specific stats. What are the stats you'd like to share with us?
Well, really, right now, we're just fighting more people falling into medical debt is the biggest thing. Unfortunately, it is at about 68, 69% right now of all bankruptcy is just medical debt. It's really easy to have an emergency. Unfortunately, if you're not on an insurance plan. I was just speaking with someone this morning that, had gone to the emergency room for a small thing, but he went a couple of times and he just hadn't spoken with me previously. I would have, of course, gotten him on something, even if it's a $0 plan. You want to do that. And you always want to go to urgent care instead of emergency room. The difference in price can be immense, and it'll be for the same services. So unless it is a life-threatening moment, you will always want to go to urgent care, even if you don't have insurance. Go to urgent care. I also wanted to share that, if you just lost insurance and you feel like you don't know a broker, you don't know what to do next. Somebody told me, I thought I clicked on my marketplace plan. I swear I clicked re-enroll, but that button, it processed and then it said that it didn't work. So now I'm stuck and it's February and I have no insurance. You can't help me. And I said, well, hold on. Thank you so much for sharing with me. Actually, you can. So just speak to someone because I mean, you have a special enrollment period just for losing coverage. Just because you lost it, you can, for 90 days, have the possibility to re-enroll. And 23 million people just got dropped off of Medicaid. So this is a big thing that's happening right now. I don't want anyone to feel stuck. Just speak to someone. Ask first before you assume that I'm just not going to have coverage for the year. Especially those that are getting dropped off of Medicaid is because you qualified financially. And now that you're off of Medicaid, you're very likely to qualify for a subsidy just as well. So check that out. And as far as, us and mostly the women here, I wanted to just share to take the consultation, even if it's not with me, speak with a broker, because right now it's 1/3 of women right now that want to depend. They're saying, so, studies say they would depend on Social Security to be their primary source of income in retirement. And the average Social Security check right now is only $1,400 a month. So I just really encourage us to learn more and just network with women that know more than you. If you're not going to buy services, that's okay. Just get to know someone that you would like to be a little bit more like. You would like to know more of what they know about. It's worth your time.
Awesome. Yeah, because no one realizes how we're one paycheck away, one accident away from being either in debt or homeless. And it's terrible that we have to live by that with that over our head. And at the same time, it's just, what can you do? When you don't have the coverage, you hate for anything to happen because I can't afford to pay for it, or who's going to help me pay for it? And it's just a lot of questions. So thank you for leaving that information. So that way we have something to think about and to research, because the information is out there. You just have to go look for it. And that's why I'm so glad that you came on, so that way you can talk about it and be able to share your resources. So that way people aren't in the dark. Because there have been times when I look at family members and it's like they go to emergency and they end up having to pay these exorbitant bills, and it's unbelievable. And it just makes you wonder, how can we do things better? How can we do things differently? So I really appreciate that, Andrea. So any other information you'd like to share?
Really, as far as us women here, again, I wanted to say that women-owned businesses make up nearly 40% of all companies in the U.S. And nowadays, women are the decision makers for 40% of invested money, which is about $11 trillion. So just to keep growing, we're doing incredible things. We've come so far. Over the last 40 years, women's earnings have more than quadrupled. And that's because we're doing things like this, like podcasts where we can communicate with each other, like learning about health insurance, like becoming financial advisors. It's a massive movement, and it is gaining so much traction in these most recent decades. So just that, to keep going. And I'm here as a resource to support that.
Awesome. I'm so happy to have you talk about that. So we're going to be closing right now. So do you have any closing thoughts? Anything else you'd like to share? Just, well, for one, where can we reach you? Because I'm pretty sure people are going to want to talk to you. So how can we reach you?
Oh, absolutely. You can find us online. Our website, for starters, is healthunicorn.co. That's healthunicorn.co. And right there, you can, put in your information. You can also schedule a consult by texting the phone number. That textable phone number for us is 727-808-4705. One more time, that's 727-808-4705. You can text there to set up a time in advance that's going to work best for you. And I also want to just let people know that we offer more than health insurance. Our free consultations also review for things like accident coverage, chronic illnesses, dental, vision, mental health benefits, which is extremely important, you know, those foundational things to make sure that you are in the best mental health status possible for your life so you can advance. Those things are amazing. And those mental health plans, they don't consider health, they don't consider age, anything. Those plans, I want to say, are $40 a month actually right now with our company. Very affordable. We were able to bring that price down with a certain contract and just, company that we're working with. So we're happy to offer that. And that's a standalone. So if you need one thing, but you don't want anything else, you can do that. If you want to plan that, if you're an entrepreneur, maybe like me, and sometimes your employment changes or you pick up a part-time here and there, you don't want it to be attached to your benefits. That's exactly what we help with, individual benefits. If you find you're having a lot of out-of-pocket costs, maybe you have some few medications and you want to get more out of your health coverage in regards to that, we can help with plans like that. If you have a weight loss doctor, holistic doctor that your health insurance is not covering for you, but it's a regular cost for you, reach out for us about things like that. 75% of claims filed are accidents. So just, think about that for a second and just prepare yourself because it happens. I feel like eventually for most people is the way I put that. And whether that's a small event or a big event, no one ever knows. But accident plans are extremely affordable. I'm talking $25 to $50 a month max to cover the whole family. So you can benefit financially when these things do happen. You can do more than cover your deductible. Nowadays, the deductible for people are anywhere between $5,000 to $10,000. And, that can hit the bank hard. And after that, you still have to take care of your loved one, take time off of work, so on and so forth. So these are the types of things that we can help you in an affordable way to be prepared for. It's too easy to fall behind. So I'm very passionate about helping prevent that for people, really.
That's awesome. And like I said, I'm so glad that you're here to talk about it because it's more to it than just signing your name off on a policy. It's more to it than I'm so glad that you're able to explain things to people, give them the options so that way they're well informed. Because I believe a lot of people would probably be more apt to do some things if they were more well informed and given the choices of their benefits. So kudos to you for helping like that because we definitely need it. And just I commend you and thank you so much for sharing your information.
Absolutely. Free health insurance education from Health Unicorn at any time, guys. I am happy to share it because it will better your life, whether you're, become a client or not. You'll be well off. So there's that. I'm here as a resource and I'm wishing you all the best. Thank you for the time here, Jamila, and this opportunity.
Thank you. And like I said, everyone, if you have any questions, feel free to check out the show notes. And I appreciate you. Yeah, I'm just so excited to have you on the show. And just definitely, would like for you to come back on so that way we can discuss any changes. Because I'm pretty sure with new laws and new things like that, I'm pretty sure there's going to be some changes. And I definitely would like for you to come back and talk about that. So please put me on your schedule. I really appreciate that. So in closing, thank you, Adriana, for coming on the show. And as always, everyone, I want you to be inspired, be inspiring, be encouraged, be encouraging. But most of all, I want you to be you and check out the show notes because I definitely want you to be in contact with everyone that's on the show. So have a great one and I'll chat with you next week.
Bye, guys.